Good evening. My name is Bridgette Baker, and I'll be your webinar producer for this evening's event. I am pleased to introduce the National Coalition of 100 Black Women, Inc., National President Elizabeth A. Jones.
Thank you for tuning in to the NCBW COVID-19 Public Education Series webinar. The topic for today is COVID-19 boosters are critical for everyone. It is my pleasure to bring greetings on behalf of the National Directorate and members that comprise the National Coalition of 100 Black Women, Incorporated. NCBW is a 40-year-old advocacy organization with a network of 62 nonpartisan and nonprofit chapters across our nation that advocate on behalf of Black women and girls to promote leadership development and gender equity. We engage with and advocate within political, economic, and social institutions to accomplish our mission and goals. NCBW's targets are health, education, and economic empowerment. We are grateful for the continued support of our sponsor, the U.S. Department of Health and Human Services, and our partners, the Black Coalition Against COVID, the Black Women's Agenda, Walgreens, and We Can Do This for making tonight's webinar possible. Now it is my pleasure to introduce NCBW's National Vice President of Programs, Ms. Minnie Miller. She has served NCBW at the local and national levels for over 25 years. I present to you National First Vice President, Minnie Miller.
Thank you, Madam National President Jones. It is my pleasure to introduce our facilitator for the National Coalition of 100 Black Women, Incorporated COVID-19 Public Education Series, Dr. Reed Tuckson. Dr. Tuckson is a physician who has, among many leadership opportunities, served as the Commissioner of Public Health for Washington, D.C., and president of the Charles R. Drew University of Medicine and Science, one of the 4 historically Black academic medical centers. He is also a co-founder of the Black Coalition Against COVID. Immediately following the poll, How Much Do You Know? You will hear from Dr. Reed Tuckson.
All right, and good evening. This is Bridgette Baker once again. In just a moment, you'll see the poll popping up on your screen, and we encourage our audience to participate in this segment of How Much Do We Know? The first question is, does vaccination and booster doses protect individuals from both infection and severe outcomes of COVID-19? Yes or no? So we'll give you about 30 seconds, and we see that quite a few folks are responding here on the audience. Thank you. All right, we'll give you about 10 more seconds or so, and we appreciate your participation. If you're with us live via Facebook and YouTube, feel free to drop your yes or no answers into the comments section as well. We would love your participation also. All right, so let's close that one out. Let's move on to the next question. All right, so the next question that's on the screen is, for adults and adolescents, are they eligible for a first booster dose? Are the shots safe? All right, so the question is, are they eligible for a booster dose, and are the shots safe? Yes or no? All right, we'll give you about 10 more seconds before we move on to the next question. All right, we see quite a few of you are participating. Thank you. All right, pretty much all of us have responded. Let's go ahead and close that out and move on to the next question. All right, and the next question is, do booster shots provide substantial benefit? Yes or no? Okay, booster shots, do they provide substantial benefit? Yes or no? All right, thank you for your participation. Okay, we see some comments coming through on Facebook as well. Thank you. All right, we'll have about 10 more seconds there. All right, let's go ahead and close that out. All right, and the next question will pop up in just a moment. It is during the recent Omicron surge, those who were boosted were 21 times less likely to die from COVID-19 compared to those who were unvaccinated, and 7 times less likely to be hospitalized. Is that yes or no? This is a more of a true or false, but yes or no. Is that true? Yes. Is it not? No. All right, we'll give you about 10 more seconds or so to respond. And we have a very heavy participation from the audience. Thank you very much. All right. And let's go ahead and close that out. All right, and the next question, this is our actual final question. The CDC continues to recommend that all eligible adults, adolescents, and children 5 or older be up to date on their COVID-19 vaccines, which includes includes getting an initial booster when eligible. All right, so once again, CDC continues to recommend that all eligible adults, adolescents, and children 5 and older be up to date on their COVID-19 vaccines, which includes getting an initial booster when eligible, yes or no. All right, and we'll give you a couple more seconds on this one, give about maybe 5 more seconds before we close it out. All right, well, thank you very much for your participation in the poll, and I'll hand it back over to Dr. Tuckson.
Well, thank you very, very much. And it is a terrific honor to be with all of you yet again. I want to really celebrate the opportunity that we at the Black Coalition have to be in partnership with the National Council of Black Women. This is an extraordinary relationship that bodes well for many health issues in the future. For your information, the Black Coalition Against COVID represents the combined medical professionalism and community-based experience of grassroots influencers in Washington, D.C., but also our 4 Black medical schools, the National Medical Association, the National Black Nurses Association, the Urban League, and the great organization blackdoctor.org that provides so much information online for the Black community. Well, we gather now at a very important moment in this pandemic journey. To put our conversation in perspective today, on September 9th, 541 Americans died of COVID. On the 8th, 674. On September 7th, 788. You do the math. You can see that this is definitely a pandemic that has not gone away. This ain't over. 1,045,000 deaths, and unfortunately, disproportionately Black. It's important also to note what's at stake tonight as we look forward. Life expectancy at birth, we now know from data reported in the last 2 weeks, life expectancy in the United States has declined nearly a year from 2020 to 2021. So from 77 years of life expectancy, it's now down to 76.1 years. This is the lowest life expectancy in the United States since 1996. Along with a 1.8-year drop in 2020, this is the first 2-year decline in life expectancy in the United States since 1921. For Black folks, we dropped from 71.5 years of life expectancy in 2020 to 70.8 in 2021. Our life expectancy at birth in 2021 was the lowest since 1995. We have work to do. Especially painful has been the impact of these deaths on our children. I am sad to report to you that between April 2020 and June 2021, 1 in every 310 Black children lost a parent or a caregiver, compared to 1 in 738 white children. We have suffered, and we are still suffering. And so now it's time to act. And I can't think of any better place to continue to push forward than with the NCBW, because we know that women are the health officers for the family. And so I applaud NCBW for producing tonight's town hall, where we will talk about COVID-19 boosters are critical for everyone. And we will answer all of your questions regarding vaccines, boosters, and other elements associated with this pandemic. We have a great panel of trustworthy and knowledgeable experts who are standing by. So please feel free to put your questions in the chat. I'm pleased that Dr. Peter Marks is with us tonight, the director of the Center for Biologics Evaluation and Research at the FDA. Simply put, Dr. Peter Marks is the person who is responsible for making the decisions ultimately about which drugs and vaccines are approved at the FDA. He has been a real partner with the Black community, and I think now Peter Marks must have done at least 10 national town halls with us. That's the level of commitment he has to our community. Kiva Nelson is the lead public health advisor for the Division of Policy and Performance Management in the Office of Women's Health. And we are so glad that she is here because it is, I think, one of the goals of our relationship tonight is to advance and extend the relationship between NCBW and our Office of Women's Health at HHS. This is a very, very important office that has a lot to offer the Black community, and we are now happy that Kiva is with us. Dr. Jihan El-Bayoumi is a physician in active practice in Washington, D.C., an expert on COVID, and also a founding director of the Rodham Institute and a co-founder of the Black Coalition Against COVID. And so with that, let's get right to it. And starting with Ms. Nelson, Kiva Nelson, from your perspective, what does it mean for women to be, as I described them at the intro to the show, the health officers for the family in general and for COVID specifically?
Thank you so much, Dr. Tuckson, and thank you to the NCBW for inviting me to be here with you today. As mentioned, my name is Kiva Nelson. I'm a lead public health advisor with the HHS Office on Women's Health, Division of Policy and Performance Management. When we look at how women serve as the health officers for the family, it's important to note that women serve oftentimes in a number of roles and can be managing their careers, taking care of their families and friends, as well as handling other responsibilities, all while putting their personal needs behind the needs of others. There's a saying often made that you can't pour from an empty cup. If you don't take care of yourself, it is impossible to take care of others. So think about what you need to be at your best health, especially when it comes to your mental health and wellness. Commit to doing something every day towards being the healthiest version of yourself. Pay attention to the changes that you may notice in your health and make sure that you schedule visits to visit your health provider to discuss them. Ask questions and work with your provider to create a plan for wellness that works for you and your health needs. If you are feeling overwhelmed or are unable to complete your daily or regular tasks, reach out to your support system, such as a health professional, a family member, a friend, or place of worship. Don't be too proud to ask for help. Find a buddy or an accountability partner to help you focus on your wellness plan, because at the end of the day, we are considered the leaders of the family's decisions on health. And it's important that we give ourselves the permission to slow down and remember that small steps are still progress. Thank you.
I really think that is really, really wonderfully well stated. And as a Black male, I will have to tip my hat to all of our sisters. I am aware that 70% or so of all the health decisions in the family are done by women. And as you so wonderfully stated, that if your cup is empty, you can't give to others. And so let's just celebrate that. And thank you for that. Well, as we look now for where we are in the journey with this pandemic, we are hearing this term endemic, that we are certainly in a different place today than we were even 6 months ago. From the perspective of the Office of Women's Health, how do you sort of understand where we are in this journey?
Sure. The pandemic has changed how we manage our day-to-day activities and how we also interact with each other, our family, our friends. It's also shown us the importance of protecting our personal health and the health of our loved ones. Since the start of the pandemic, we've learned more about COVID-19 and made such advances such as the COVID-19 vaccine and boosters to protect our communities and decrease our risk of severe illness and death. One of the efforts that HHS has developed was the CDC's COVID-19 response health equity strategy, which looks at current data and expands programs to reduce COVID-19 disparities amongst communities, such as the African American community, known to be at increased risk. Each day, we are learning more and working hard to make sure that our communities continue to stay healthy and safe. So as we look at where we are in the pandemic, we see that some of us may have returned to some of our routines from pre-pandemic, while others may have not. Whatever your day-to-day looks like, it's still very important to make sure that you continue to take steps to protect yourself from COVID by getting the vaccine, including the boosters, wear masks, and social distance whenever possible. The FDA recently approved vaccines targeting the Omicron that are recommended for all, including those over the age of 12. And we are tasked with sharing that information and that knowledge with our family and loved ones.
Beautiful. Well, thank you so much for those perspectives, and we'll come back to you later in the show. And now I want to turn to Dr. Peter Marks and help us to understand where we are now with vaccines. And Dr. Marks, congratulations on the recent announcements about the new boosters. Talk to us, help us understand sort of what's happened, what's changed, and why you are so excited about these new tools in our armamentarium.
Thanks. And first of all, thank you, Reed, for doing this. I think it's really important that people get to understand why we authorize these new boosters. When we first had the COVID-19 vaccines, they did a really good job at not only preventing death and hospitalization, but they also prevented us from getting symptomatic disease. People just got vaccinated, and then 95% of people didn't get COVID. They didn't get symptomatic disease. And actually 60 to 70% of people didn't transmit COVID. But what happened was that with time, the immune reaction that one had wore down, and we had the development, probably a larger part of this, the development of these variants. The virus moved on and changed. And because it changed, we now have to try to keep up with it. When it changed, it started to evade the immune system. And now we have tried to catch up with it by making a new component to the vaccine. So the bivalent vaccine means we have the original component and then a new component that is able to chase the virus where it has evolved to. And it so happens that we're lucky enough right now that what we chased it, which was this BA.5 variant, is about 88% of what's circulating right now. That's the booster that's available right now. The component is targeted to the BA.4/5, that particular variant. So we actually have what's a nice match there to hopefully now restore protection, though we can't guarantee it because we won't have the data for a few months, but we're hoping that it not only prevents the hospitalization and death, but now it also will help prevent symptomatic COVID-19 and the problems that come after having symptomatic COVID-19, like long COVID symptoms, such as brain fog or trouble with breathing or trouble with your heart after having COVID.
I know that one of the things that, we will see how effective these will be for the long run. But the one thing I know that you're confident on, and I'd like you to speak about it, is the safety of the new booster. And talk a bit about the process of the data that you used and also the approval process. And as you do that, Dr. Marks, I wanted you also to mention whether or not physicians or scientists of color are involved in supporting you in making these safety decisions.
So let me start actually with the second piece, okay, which is that we have a very diverse workforce with people of color involved in this. And in fact, our advisory committee includes people who are on the faculty of historically Black medical colleges. So I think that's an important thing for people to realize. It's something that we demand in our organization because that's the right way it should be. As for the safety of these vaccines, it's pretty amazing. You know, they used to have a sign. I remember when I was a kid, I used to be impressed with the sign at McDonald's when it said billions served. Well, in this particular case, these vaccines, these mRNA vaccines, either the Pfizer, BioNTech, or Moderna vaccines, over 1 billion doses have been given to people. More than 200 million people in the United States have received these vaccines. And we have kept very good track of the safety profile of these vaccines because we have surveillance systems monitoring this both here in the United States, and we collaborate with our colleagues in Europe and Japan and elsewhere. And so I think we have a really good sense of the safety of these vaccines, and we're not concerned at all about the change over and any change to safety. We know that there are some minor safety concerns with these vaccines. We know that, for instance, there's a small risk of an inflammation in the heart for younger men particularly, but that risk is actually much smaller than the risk of getting that same inflammation in the heart if you get COVID-19. So the benefit to risk here is still far in the way of taking these vaccines. And I think that's really what people need to understand here, is that there's a lot of noise out there about side effects to things. But you know, these vaccines can, you know, the benefits so far outweigh the risks that we really need to understand that. And particularly, you know, if you have some type of respiratory condition or immunocompromising condition, or if you just happen to be over 50 or 60 years old like me, it's probably a good idea to get these because they can, I mean, it's a good idea for everyone to get them, but it's probably especially important that people get these boosters because they really could save your life. And I would say that anyone, that's why we're working right now to try to get these boosters to be available for the entire population and not just adults and adolescents, which they're available for right now. But we want everyone to be able to benefit from them.
I'm so glad that you mentioned, Peter, about your relationship to scientists around the world. One of the things that we, in so many of the town halls that I do with the African-American community, is we look at this as if only through the prism of America. Sometimes it gets colored by the prism of race relationships in America. But you are supported, as you indicated, by, this is a worldwide science establishment. And I think that's one of the things that we need to start to appreciate. One of the people in our chat has already asked Dr. Marks. I think you've already answered the first one, which is what's different about the new booster. And I think you mentioned that it's a bivalent now. That means it has two components to it, as you described, taking care of the previous variants and taking care of the new variants. But someone also wanted to kind of know, we only have to take one flu shot annually. Why so many booster shots after we're fully vaccinated?
Well, right now, there's a hope that maybe we'll just need one booster for COVID-19 for this year, but we don't know for sure. The viruses are all a little bit different, and COVID-19 is caused by a virus, coronaviruses, which also cause the common cold. A different type of or can cause what we consider the common cold. And they tend not to generate the best durable immune responses. So we're having to give these boosters to try to keep up our immunity. Now, the good news is if we get it right, and this booster that we've given now is able to cover the variants that are circulating now and the variants that might evolve over this winter, we may get away with one booster this year, which is the goal. But you know, I like to be an honest person, so I just want to tell you, that's my hope and my aspiration. But I can't promise it because we need to do what's right to save as many lives as we possibly can and to alleviate as much suffering as we can. And although I know people don't like getting shots, you know, most people a shot's a lot better than the alternative if you get really, really sick and end up in the hospital or worse. So we'll only do this if we have to, in order to save lives. We don't benefit by having more of these. It's not like at FDA, we don't get any benefit by having any more boosters than we need to. It's a big undertaking to do this. So that's why we're really hoping that this works one and done for this year, but can't promise it at this point.
Do you worry, as somebody in our audience is, that if we are taking series of booster shots, that the cumulative effect might be ultimately negative or dangerous? Are we introducing too many variables by piling up booster over booster?
We've seen this. We've seen these mRNA vaccines given in the past, multiple doses, and we've now seen people get multiple doses. And that includes people who have now had 4 or 5 doses who are immunocompromised, as well as some older adults who aren't traditionally immunocompromised. And we don't see any adverse effect on this. What we do see is something that you already mentioned at the topper, which is that look, we know in places where people got 4 boosters, they had a lower death rate than people who had only had 3 boosters. And those people had a lower death rate than people who had 2 boosters. And since, to me, death is kind of the show me the money aspect of this, which is that, if fewer people are dying, it also means very likely that fewer people are getting hospitalized. And that also means probably that fewer people are getting disease. So I think we're pretty comfortable with this. Again, like any medical intervention, we want to have the minimum number. So the idea here is we don't want people to do like some guy in Germany did and get 90 COVID-19 vaccines over the course of time. Okay, he had other reasons for doing that, but we want people to get the right number to keep them safe. And we will only authorize, and I say that again, we will only authorize these vaccines when we think they will have a true impact that is benefiting public health.
Well, let me turn to one place where we really are clear on benefit, and that's with kids. And I noticed that there was an important New England Journal of Medicine report the other day that talked about that 2 doses of the Pfizer vaccine reduced hospitalizations by 83% in children 5 to 11. So tell us about where you see us going with childhood vaccines.
Yeah, so for right now, we have a major problem in this country, which is we don't have enough 5 to 11-year-olds or 6-month to 5-year-olds vaccinated. There is a way under vaccination there because people have felt, oh, well, COVID-19 isn't so bad, or they've listened to various sources that seem to say that. Unfortunately, there was some mainstream media that picked that up, and even some Congress people who seem to pick that up. Well, it's there. Let's again be truthful here. It's true. Children get less death from they die less frequently from COVID-19. They're hospitalized less frequently, but certain component of children, and the CDC says only half of them had other conditions, right? Immunocompromising conditions. So this is something I'm kind of trying to prevent an argument that sometimes we get that says, oh, the only kids that get sick from COVID and die are the ones who had other conditions like immunocompromised. That's not true, because half the kids who have died from COVID, they were normal kids from what everyone could see. And there have been enough deaths that we're now approaching, the number of pediatric deaths. Granted, it's a smaller percentage, but having hundreds of children die of COVID-19, something that you could potentially prevent with a vaccine, we wouldn't accept that for influenza. We wouldn't accept that for diphtheria, pertussis, measles. So why should we accept it for COVID? We should get our kids vaccinated, especially because that risk of myocarditis that I mentioned it does not seem to be there in any significant extent in the younger children. It does seem to be something that probably has to do with male sex hormones, and so you don't really see it kick in until puberty. And even then, I've told you, and I'll say again, the benefits far outweigh the risks.
Thank you.
But for the kids, the risks of this are really pretty. They're pretty small. I mean, yes, it's true. There's a small number of children, 5 or 10% may get a fever, but they're generally not high fevers. In general, the youngest children actually had fewer side effects than adults did. So it does seem like, we do so many other things to try to set our children on the right course, right? Some of us spend hundreds of dollars on vitamins or supplements or things like this. There's a really simple thing you can do that could save your child's life.
Okay, perfect. I'll come back to you with some of the other questions in a minute, Dr. Marks. I'm going to turn to Dr. El-Bayoumi for a moment. And one of the things that I'm very sad to hear Dr. Marks mention is that we're not doing very well in immunizing our young people. You have interacted with a lot of people, Dr. El-Bayoumi, in your practice and in your work in the community. What are the biggest challenges that you're seeing in encouraging people to avail themselves of COVID vaccines?
Thank you, Dr. Tuckson, and thank you to NCBW for including me on this webinar. I'm a professor of medicine at GW. I'm a general internist. My practice is from 16 to 106, and I take care of patients both in the outpatient and inpatient settings. So I think obviously there are different reasons for different people to decline the vaccine. But I think when we're talking, let's focus on young Black people who are living in some of the most vulnerable wards or areas of our city. In DC, it happens to be Ward 7 and 8. I think, when we look at, let's say, gun violence, how many people have been killed and shot? People are very smart. Young people are very smart. They do a risk stratification. Is it worth it to get the vaccine for something that's abstract from an illness? Or do I worry about, getting shot? And this is work actually that was done in the AIDS epidemic, published by the Black Anthropology Association, where they looked at the use of condoms in the AIDS epidemic among young people. And guess what? It was the same thing. Why should I use a condom if I'm going to die anyway? So I think that, and there are other people, of course, other reasons. I'm focusing on sort of younger people, teenagers and adolescents and young adults, because that's really the group that has sort of been the most reluctant to get vaccinated. And I believe that we really need to have a focus campaign for them. So believe it or not, lack of hope is something that impacts choices. It also impacts how people take care of themselves on a day-to-day. I think distrust, of course, and we have talked about certainly the work that we have all collectively done, and specifically the Black Coalition Against COVID with the descendants of the Tuskegee experiment to really try to reduce that distrust for all the reasons that we know, has helped. But again, there are segments, you've mentioned children, you've mentioned the latest statistics in DC. So I think we've got to be smarter about how we address these gaps. Right now, I'm working with grandparents against COVID. And grandparents, whether biologic or not, elders, are very influential, and specifically the women, the elders. And they actually, we do mock conversations to anticipate what people might say so that they are prepared with good answers. But I think that we really need to look at this, not just for COVID, but for a variety of issues, because guess what? Mental health is the number one priority of people right now, primarily in African American communities. It's not physical health. And that makes sense. Again, it's about prioritization. If you're not here, then how can you even get to the places to take care of your physical health?
I'm
So
glad you mentioned Tuskegee. And I just want to remind the audience, as you are talking to other people in your orbit, remember this fundamental thing about Tuskegee. And this is what Dr. Albayumi and I learned by talking to the descendants of the people that were in that trial. Those men died or needlessly suffered because they were denied access to the drug that would have saved them. And what those descendants of those men are saying, it makes no sense for the Black community to be angry about Tuskegee and then deny yourself the drug that would have prevented you from dying. It's just, it's illogical. And so when we decide to be upset legitimately about Tuskegee, don't play in the hands of people who are racist and who don't care about us by doing exactly to ourselves what they did to us. Dr. Albayumi, talk a little bit to us about something that gets almost no attention in our community and needs to get much more, and that's something called long COVID.
yes,
Talk to us about that and why it is important in the context of getting vaccinated.
absolutely. Long COVID, for anybody in the audience who's had to deal with it, is no joke. It affects almost every single organ system that we can think of. You can't get up out of bed. You feel some people can be very depressed. They can't concentrate. They can't work, lack of energy. What we do know about long COVID, we don't know so much about the differences along ethnic lines or gender lines. But we do know that when you get vaccinated, and the severity, even if you get COVID, is not as bad, is not as severe, your chances of getting long COVID are less. Said another way, 30% of people who had severe illness from COVID ended up with some form of long COVID 6 months after their infection. We know that the vaccine reduces severity of illness and deaths. So if you take the vaccine and reduce your chances of getting very, very sick, your chances of getting long COVID are also less. Now, what we need, though, is we need people, just like people who are enrolling for the vaccine trials, we need people to enroll in the long COVID trials. And this is where disparities, racism in healthcare is a real issue, because people are not necessarily, African Americans and other minority groups are not necessarily identified as having long COVID, number one. Number two, these trials may not be offered to them. And we really need to understand so that we can treat. Now, another thing is, does the current treatment for COVID affect long COVID syndrome? We're not sure. That data is still coming out. There are some suggestions that it may help, but we don't know. But I will tell you one thing that I've observed in terms of the treatment of COVID. Black people do not get offered the treatment nearly as often as their white counterparts. I was just taking care of somebody who lives in rural North Carolina who had a heart attack, 68 years old, has COVID, and was not given the medicine. I'm like, wow. Really? We know that COVID can make conditions worse, whether it's diabetes, whether it's high blood pressure. So if you have these illnesses already, it just makes them worse.
Well, let me then, with that very important point, turn back to Peter Marks real quick and just give us a sense, when Dr. Albayumi is talking about treatments, just what are the treatments available to us?
And so probably the one that is pretty simple is Paxlovid, which is basically something that one can get. It's an oral medication that when one has COVID-19 that's not very far out of control, it's been essentially the first line thing to be getting. And I'm going to just say this is an absolute this is absolute truth, is that people are not getting this enough. And it really worries me that, you know, I've witnessed this with white people, and it's happened even more with Black people, that they're just not getting this prescribed when it should be, because this is not like fine wine that we should be saving for some special occasion. This is something we should be using to prevent people from, particularly people who have respiratory conditions or who have a little bit more symptomatic COVID. We don't want to have those people end up in the hospital. So this is something where it is good to, if you can't remember the name, just, remember to just say, hey, doc, I have asthma. I hear there's an oral medicine that I could possibly take that could help me with my COVID. Can I please get it? Now, the good news too is that pharmacists now are able to dispense this in certain circumstances. So that would be another thing to potentially look to. Now, the other things that there are antibody treatments that are given by vein, but those are usually given in more specific settings. And sometimes they're given to help prevent COVID in people who can't make good antibodies. And generally, you would know that if you were under a doctor's treatment for some type of immunocompromising condition, they would probably know to ask you or to give you that medicine.
So let's be very clear here between both Dr. Marks and Dr. El-Bayoumi. There is a drug called Paxlovid. It is an antiviral drug. If you take it within the first 5 days of your experience of having symptoms, then it seems to work very well at helping to diminish the impact of the COVID disease. And so we need to be aware of it. And so I'm begging all of you, make sure you have a relationship with your doctor so that when you are first symptomatic or you test positive, let your doctor know, and then you can have a conversation together about whether or not you should be getting Paxlovid. But you've got to advocate for yourself. I haven't forgotten you, Kiva, and I'm going to come back to you in a minute, but I want to go a really, really fast, quick ones from you, Dr. Marks and maybe Dr. El-Bayoumi, on a couple of vaccine questions. Number one, very, very fast answers. We're entering flu season, and the recommendation is to receive the flu and booster simultaneously. Should you do that? And how do you know if you have a reaction, whether it's the flu or the booster? Peter, you're still on mute there.
Let's see, there you go. Someone unmuted me. Thank you. So really quick, it's okay to get the conventional flu shot and the COVID-19 vaccine at the same time. The likelihood that you're going to have a bad reaction to the flu shot is reasonably low, and the benefits of potentially getting them in one sitting so that you're done with it. Really, if that's most convenient for you, perfectly fine to do. A variety of vaccines are fine to give with the COVID-19 vaccines.
Very quick question for you, Dr. El-Bayoumi. What can be done to help Black people feel more secure in what is being said about taking the vaccine and the clinical trials?
So come to the Black Coalition Against COVID.org website. Talk to people that are clinicians or scientists of color. Go to, places that you trust. Go to the CDC website. I think this is where relationships with your clinicians, your doctors who are of color are really important, I think.
Good. And also, I think we're both excited by the work that's being done to include more people of color in clinical trials. And I know that that's a big agenda, and I think NCBW will be very helpful for that, hopefully going forward. Dr. Marks, real quick response to rebound COVID when Paxlovid has been prescribed. Is this a big deal?
It seems to occur occasionally. It's being studied, but I'll just say this, if you have rebound COVID, there are a couple things that can be done, but frankly, if it keeps you out of the hospital, again, that's not a reason not to take this. It's not a reason not to take this because that is a possibility. It has occasionally occurred, and there are some prominent people who it seems to have occurred to. But that being said, those people still, they're not in the hospital. They're alive and kicking. And so I think just remember that sometimes we hear about these things. That's not a reason not to take this drug. It's just a reason to be aware that it can happen. And you tell your doctor if you've gotten symptoms again. It's just so everyone knows it's being studied because people want to understand whether the actual course of Paxlovid should be longer than the 5 days that it is. It was originally studied as 5 days and 10 days. And there are some that think that maybe it should have been a longer course, but we'll see what the data actually show.
I think it's also about expectations, just like with the vaccine that does not prevent COVID. It reduces the risk of death and hospitalizations. It is the same. It is also true with the treatment.
Thank you. Dr. Marks, if your immune system is weak and you have underlying conditions, should you still get vaccinated and take the boosters?
You absolutely should get vaccinated. In fact, your doctor will know that they can actually give you an additional vaccine as part of the initial series to help try to bolster your ability to have an immune response, because sometimes that extra vaccine, it has been shown that it can give you a higher chance of having a good immune response. So still a good reason. The only reason why you shouldn't get a vaccine is if you have a known allergy to one of the vaccine components, which the major one that people sometimes are concerned about is polyethylene glycol. But that's the only thing that I would say.
That's very important. Say it one more time, please.
Basically, unless you have a known allergy to the vaccine components, and the major one would be something called polyethylene glycol, there's no other reason not to get a vaccine.
What about if I want to get my shingles shot? So can I get the Dr. El-Bayoumi, can I get my shingles shot too?
Well, that one is, I tell people to space it out by 2 weeks, because 2 to 4 weeks, because shingles vaccines usually cause a pretty, I've had both, a pretty, some couple of days of not feeling great, kind of a red arm, sore arm. It's dramatic compared to, for example, the flu vaccine, right? Or even in some cases, the COVID vaccine. I think the shingles can be actually worse. So to the point that was made by one of the audience members, I would space it out so that you don't feel awful. And God forbid, if there is a real reaction, not just a sore arm or a low-grade fever, we can distinguish what it is. But I keep them separate.
Yeah, that's one where I will totally agree with you. That and live virus vaccines. If, for instance, if you're going to be traveling somewhere where you have to get the yellow fever vaccine, I would get those separate, because those are ones where, but the conventional vaccines, like, let's just name some off: influenza vaccine, a tetanus shot, a tetanus booster. Those are fine to give. It turns out that the reason why the shingles vaccine is a problem is because it has an adjuvant in it to help the immune response. And that adjuvant, it really gives you a sore arm, especially when you go out for the second dose. And I don't think you'd want both arms. You wouldn't want a COVID shot in one arm and this in the other one. So I couldn't agree more. Space those out by 2 weeks.
And the last quick question from the audience that I want to make sure about is they want to know about natural immunity. Why do I need to take a booster if I've already been infected and I've got natural immunity now?
So this is a great question, because I know it doesn't make total sense, but it turns out that the natural immunity that we make against this virus, particularly against Omicron, is not really good. Just as I was saying, that's been one of the problems here, that our bodies don't generally make really, really good immune responses against these coronaviruses. And the vaccine, we know from that, this has been well studied, we know you get better immunity from the vaccine because it has some of that properties of an adjuvant to it, that it stimulates a better immune response. So even if you've had COVID before, you might wait a few months. Don't get me wrong. You might wait a few months since you've had COVID, but you should still get a booster.
Great. And for anyone who wants to know about the timing of when to get the booster versus when you last had your previous booster or, those things, go to the CDC website. If you just put in Google cdc.gov, and you just say, when is the timing for my booster? It will give you a formula. You can just play it. It's a little online interactive game that you can play, and it'll tell you exactly when you should do that. So we won't try to cover that now. Kiva, you've been very patient, and I want to just get to an issue that I know is one of the major priorities for the Office of Women's Health at HHS. When Dr. El Bayoumi and I were doing our work early on in the pandemic, when we had to quarantine, and many times, as we know, when you test positive or you have symptoms, you need to isolate yourself. The African-American community, disproportionately, we live in multi-generational families. We're kind of all together. We're suffering from real mental health challenges that Dr. El Bayoumi mentioned. We got food insecurity, housing insecurity, financial insecurity. That leads many times to people doing substance abuse. Women can be very vulnerable in these environments. How can you help us to help the audience to know where to turn if they find themselves in this heightened pandemic mental health challenged era? How do they sort of protect themselves from these issues of domestic abuse?
Well, thank you so much for your question. As COVID-19 restrictions are easing and life is returning back to normal, we in HHS are beginning to realize some of the unintended consequences of COVID, one of which includes sexual and or physical violence by an intimate partner. And we are also aware that during the pandemic, additional aggravating factors such as household stress, loss of income or employment, food insecurity, spousal substance abuse were amplified by these additional stressors of being cramped in living conditions and isolation with some of the abusers. So the Office on Women's Health has taken some steps to address this. The first of which, we're looking to learn more about the issue. And we have done this by putting forward a virtual listening session on intimate partner violence. And we are very interested in inviting all of you today to join us in these efforts. Our upcoming listening session is going to look at the impact that COVID-19 has had on intimate partner violence. And we would like to invite organizations, be it federal, state, local, as well as the public, to join us. It is this upcoming Wednesday, September 28th, from 10 to 12 in the morning. And I will include information on registration in the chat. I also want to mention that we've recently released a funding opportunity and are in the process of reviewing applications for a new initiative entitled Violence Against Women and Substance Use Prevention. So we, for these efforts, are partnering with, of course, OWH is partnering with the Administration for Children and Families. And we're looking to address the intersection of the following HHS priority areas: maternal health, mental health, substance use disorder, as well as intimate partner violence. So we are working, we would like to hear your voices, and it can help inform our future work. So again, I will include further information in the chat. Thank you.
And I think this is great. And as I intimated, I think this is a relationship between the Office of Women's Health and NCBW that I think will bear great fruit. One last really quick question, Dr. Marks. An IVF baby. Any reason why an IVF baby should have any special concerns about being boosted?
Not at all to me. Again, once they're the right age, they're like, there is no reason. Once they're 6 months of age, all the more precious to be boosted and cared for well.
Well, thank you for that. And now let me just go back over the questions that were asked at the beginning to make sure that we've hit those. Does vaccination and booster doses protect individuals both from infection and severe outcomes? Absolutely, yes. For adults and adolescents eligible for first booster dose, are the shots safe? Absolutely, yes. Does the booster shot provide substantial benefit? Absolutely, yes. During the Omicron surge, those who were boosted were 21 times more less likely to die compared to those who weren't vaccinated, and 7 times less likely to be hospitalized. Absolutely, yes. And we have every new data that's coming out every day that continues to make this point. This is not theoretical. This is real. It saves our lives. And finally, CDC continues to recommend that all eligible adults, adolescents, and children 5 and older be up to date on their vaccines, which includes getting an initial booster when eligible. Absolutely, yes. And we've got to get these kids up to date on their boosters. Let's remember one thing, folks. Most people don't realize it. Despite running a race with an anvil tied to our backs, all the challenges that we had, the Black community erased the deficit between Black folks being immunized and the rest of the country. We eliminated that because of the work we did, because of NCBW, because of all of our fraternities and sororities and our churches. We know we can do it. We just have to do it one more time. Thank you all of my guests for what a wonderful exchange. We have enjoyed this immensely. And thank goodness for NCBW and the intelligence and the energy of its membership. You are key to whether or not we as a community will be healthy, whether we will live lives that are maximally productive, and will have the longest possible lives that we should be able to enjoy. You are so special, and we'll do anything in our power to help you. And now I'll turn it back to First Vice President Minnie Miller.
Dr. Tuckson, thank you. I will be closing out this evening. I'd like to first start by saying thank you to Dr. El-Bahoumi, Ms. Nelson, and Dr. Marks for your participation as panelists today and for the informative and timely discussion. And at this time, I want to give special recognition to Dr. Reed Tuckson. He has been our host for the entire NCBW COVID-19 Public Education 5 webinar series. He is responsible for obtaining the highly regarded panelists that have provided education about COVID-19 and its impact on our daily lives. Thank you. Dr. Tuckson, on behalf of the National Coalition of 100 Black Women Incorporated, I would like to present you and your organization, the Black Coalition Against COVID, a check for $10,000. Dr. Tuckson, it has been a pleasure, and I would like for this to be the beginning of a lasting relationship between our organizations.
Wow, thank you so much. And I guarantee and pledge that we will put that to good use in trying to save more Black life from this pandemic. You are wonderful. And thank you so much, President Jones.
Thank you. And finally, the work we do in the name of NCBW would not be possible without the support of the National Directorate and our members, Vice President Minnie Miller, Executive Director Virginia W. Harris, Executive Administrator Alfreda Stukes, Program Associate Serenity Bryce, Producer Bridget Baker, and our National Health Committee. To our viewers, thank you for tuning in to the NCBW COVID-19 Public Education Series. Please do not forget to complete the survey. Everyone, have a good rest of your evening and good night.